Welcome to The Good Gig, a podcast where we celebrate careers. I'm really excited today to be able to welcome our guest, Dr. Abraham Butz, a doctor of emergency medicine in the beautiful state of Florida. Abe, it is great to see you. We've known each other for a long time. Welcome to the podcast.
I'm very happy to be here.
And we also have my buddy as well, longtime buddy, Jay Anseth.
Yeah, great to see you, Frank, and it's nice to meet you, Abe.
Likewise.
So I think this is going to be a fun discussion. I talk to so many students who are interested in becoming a doctor and what it means to both be a doctor and what steps are required to get into the profession. I think this is going to be a useful resource for students and really anybody interested in medicine. Although I suspect that we're going to have other podcast episodes where we talk to doctors of different flavors as well. So you're a doctor of emergency medicine. And I'm going to start, Abe, with the question of when did you decide that you wanted to go into medicine?
So that's a question I've been asked, as you can probably imagine, boy, probably hundreds of times in my life. There's several different answers to that. I guess the most prominent, or the one that kind of sits in the front of my mind the most, is that it started out with my father. So my dad, he is a retired urology doctor. He practiced medicine. Oh man, I think it was right almost around 40 plus years. Obviously, a very big part of my life was growing up in a house where my dad was a doctor, and it was there all the time. He was a really great involved father. He was at most of my activities, my sporting events, my musical activities. I played a few musical instruments over the years, and he was there. He's very involved, but he was also very committed to his profession as a physician, as a urology doctor. So every time, dinner times, sitting around the table, talking about things on the daily basis, medicine was always in the forefront of many, many conversations. So, he would definitely, I would say, he was my number one influence, as to why or how, or even how to become a doctor in the first place. It's interesting. The first thing I ever said I wanted to be when I was a really little kid, I was thinking about this earlier this evening. I said I wanted to be a pediatrician. So I wanted to be a kid doctor. Um, I was probably 6, 7, 8 years old, something like that. And I guess I just really wanted to be a kid doctor. That lasted for a few years. And then as you become a preteen and a teenager, you kind of push against your parents a little bit. I wasn't a rambunctious kid or anything. I, pretty straight laced, followed the rules of the house. But people would ask me, "Oh, do you want to be a doctor like your dad?" Oh no, that's the last thing I'm going to be. I'm not going to be a doctor. I'm going to be an architect. I'm going to be a Spanish professor, a history professor. I'm not going to be a doctor. So that he was probably my first influence. And then, through the high school years where you're thinking about going to college, I enjoyed a lot of classes. I enjoyed sciences. I enjoyed humanities. I really loved my literature classes and discussing different books and things in high school. And so going into college, I didn't have my mindset on being a doctor. So
Oh,
that
really? Huh.
kind of ebbs and flows.
Yeah, yeah. Oh, I would have thought that when you entered college, you already had it set in your head that, oh,
Nah, I knew that I wanted to take the pre-meds at least to start out, just to make sure that that was still a possibility, but I wasn't gung-ho or 100% sold on or committed to becoming a doctor at that point. But I, take the sciences, the chemistry, the biology, the calculus, things like that, just to make sure that if I did decide, then I could make the pre-med jump and all of the things that had to be done at that point pretty easily.
what was your major in college, Abe?
So I was chemistry, straight chemistry major. Um, Frank and I went to the same college, so I've known him quite some time. There were only two of us in the chemistry major field. It was me and one other guy. And I kind of gravitated towards that after my sophomore year, after I took organic chemistry. I really liked organic chemistry. Not a lot of people say that, but I really thought it was a cool course. And at that point, I'd taken general chemistry and some biology and was taking some physics. And I I tend to do pretty well in those courses, and so I thought, oh, chemistry is kind of cool. I'll become a chem major, and so a lot of the courses actually overlapped for being a chemistry major, and then the pre med. Obviously, there were a few other things, but for the most part, chemistry majors had to take most all the pre med stuff, so that was a relatively easy major. I love some other courses. I kind of found the religion department and philosophy and things like that towards the end of my career and in college. And I thought, oh, maybe that would have been a fun major to do. But in the end, I was a chemistry major. Short answer, long answer to a short question.
Yeah, so I'm trying to reflect back on my own thinkings about majors and career choices when I was in college, and I don't recall seriously considering the path of medicine, but I think for maybe a few weeks or a few months, it did enter my head. And if I'm remembering correctly, the thing that turned me off of it was I felt by the time I considered it that I was almost too far past the basic requirements. And I think it was the fact that I would have had to go back and take the second year of organic chemistry, or no, it was the second semester of physics in order to prepare myself for the MCATs or to meet the requirements. And so I felt like I was just a little bit out of sync with the pre-med requirements. And so did you feel that kind of clock as well? Because I would imagine that a lot of pre-med students are very tuned in to what the requirements are going to need to be to set them up to go to that next step. And I think I felt for whatever reason that I was now out of sync.
I think you're very right. You kind of hit the nail on the head. All the pre-med students, they kind of once they decide loosely or definitively to do the pre-med stuff, they kind of get their classes right in a row, and they make sure that they take their chemistry, their physics, their organic, their biology. They just make sure they get it all done. And yeah, there's a big time crunch in your mind as a 18, 19, 20, 21-year-old person. In retrospect, however, that none of that matters. I knew so many people going through medical school, residency. They were non-traditional. They majored in something totally unrelated, and then they went back. That maybe they worked a couple years, or they kind of were more free-spirited, almost gypsy-like, and then they came back and they did a whole post-baccalaureate pre-med stuff to fill in the gaps. And so that's really interesting. You say that you felt like you were maybe past it, but at the time, you don't see this perspective that it's never really too late to go back and do what you need to do. You kind of get pushed into this pathway that, oh, I need to do this by this time. But
Yeah.
I felt that for sure. I'm clearly sounds like you did as well. But in retrospect, honestly, that really didn't matter.
Yeah, maybe related to that, Abe. Do you? So again, I did not go pre-med, so I think I have some biases towards it, or just some perceptions that are undoubtedly just off base. But do you feel like the pre-med curriculum, did that prepare you well for med school or life as a doctor? Do you think that it's kind of focusing on the right things, or is it?
So that's a great question. Pre-med classes pretty much have nothing to do with medical school and being a doctor.
Yeah, so I don't mean to interrupt you. So specifically, what it's interesting that you're a chemistry background, because my perception is a lot of the pre-med students that I kind of was exposed to, they were very worried about organic chemistry. It seemed like that was a huge focus for a lot of them. And a lot of it was just like they needed to get a certain score. And so it always kind of came across as like um, not so much learning problem solving or all these things that you'd think would be very useful for a medical doctor, but it's just more like, okay, you have to check off these boxes and make sure you kind of.
I think you've hit the nail on the head as well for that. There were a lot of people who were just like, oh, I got to do this. I got to score well to get to the next step and get to the next step and check this box. I just kind of I just liked organic chemistry. I liked the
Yeah,
problem solving part of it.
yeah,
I'm pretty good at it, and so I just thought, oh, I'll just be a chem major. I was not, at least in my own mind, I wasn't one of those gunners in the pre med program who really kind of was checking off the boxes as much. I did my best. I worked hard. I did my best to get the best grades. I took a pre-med, prep class or an MCAT prep class, but I didn't feel like I let it run my life quite as much as maybe some others. and maybe the majority of others. I had a lot of friends who are not pre-med, probably more so than I did have pre-med friends. So maybe I just ran in a little bit different circles. But yeah, I
Yeah.
agree with you. There were a lot of people who were just so focused on the checkbox and the number and the next step for sure.
Yeah, that might be a good perspective for, students or potential, other people thinking about going down your path to, you don't necessarily have to. I just feel like a lot of people got so stressed out about it, they just
Well,
kind of,
they did, and again, at the time, I tried not to let it run my life. Of course, it was there always in the back of my mind, but I tried to keep a perspective. Again, I think that's easier done in your 40s than it is in your early 20s, but to see that anyway. But
right.
it's to try and maybe get that across to some younger adults is a good thing to maybe think about, like you said, to maybe realize like, hey guys, have I had to do it over again, maybe I would have majored in religion or music or something like that and just taken the pre-meds because you got to take the pre-meds. But yeah, definitely good points.
Yeah, I would imagine that being a pre-med student surrounded by other pre-med students who are also as engaged and interested in next steps and to some degree competitive as well probably reinforces that adherence to this kind of strict regimen that
Yeah, it's kind of this pressure cooker that you're all about and you all kind of bounce off each other. So if you can step out of that, that's, I think, a healthier thing.
so hey, maybe you can remind folks of, I guess, the different phases of this trajectory. We've talked a little bit about the undergraduate preparation. For folks who are not as familiar with the trajectory, could you kind of spell out the steps that it takes to then become a doctor?
Sure, sure. So obviously, you have to graduate with a bachelor's degree in something, and you have to take the pre-med courses, which I still think are pretty much the same as they were 20 plus years ago. It's a year of biology, 2 years of chemistry, which includes 1 year of general, 1 year of organic chemistry, a year of physics. I think still a year of mathematics. Most places they want you to do a year of calculus, and then at least a semester of English, which I think is funny. You should be doing much more than that, but I think that's the general pre-med. So you get through those courses. You obviously want to do as well as you can in those courses, and then you take the MCAT, which is the medical college achievement test. It has changed a bit over the years. Amazingly, it's kind of come back to where it was when I took it. I took it, and there were three sections. There was a biologic science, which included biology and organic chemistry. There was a physical science, which was more of your general chemistry and physics. And then there was kind of an English, which was basically reading a lot of passages and answering questions. There was a very small writing component where you had to read some things and write a very short essay, very short. And I think that one just kind of got thrown out. Again, it has kind of changed, ebbed and flowed, but it's kind of back to that same kind of format now as it was years ago. So then usually take that sometime in your junior or senior year, depending on what you think your next steps are going to be. I took it my junior year, so I was kind of prepped to run the gamut, go straight through without any time off. And then you get your score sometime in the summer before you start your senior year of college, and that's when you start applying to med schools. You start writing your essays and submitting your scores and things like that. So my fresh or my not my freshman, but by my fall semester of my senior year is when I went on my med school interviews. And at that time, you had to travel. You had to, go to wherever you were looking to go. I think I applied to 10, maybe 11 schools. Ended up going to 3 interviews, and that was maybe a little on the lower side, maybe about average. I think you applied to however many and got about 50% of those asked you for an interview. So I was in college out in Vermont, and I'm from South Dakota. So I got an interview from my state school, which I flew back to. I got an interview at Dartmouth, which was just kind of down the road from Middlebury. And then I got an interview in Baylor University in Houston, which is where my dad graduated from. So I flew down there, and in now times I think everybody does everything virtually via Zoom here, or whatever your virtual app of choice is. So I think that's not quite the same as it was 20, 25 years ago. Um, After that, you go on your interviews, you hope for things, and then it's kind of a rolling admission. I got accepted to the University of South Dakota School of Medicine in, I believe it was December of my senior year. So I was very happy. I kind of knew that at least I was going to be able to go to medical school. I was hoping for those other two places to offer me a spot, and it was a rolling acceptance. They had so many slots, people accept or whatnot. And then by the end of the year, my senior year of college, I kind of knew where I was going.
But I'm curious about the choice of schools that you applied to. I think I can understand the reasons for this three schools that you mentioned. Your father went to Baylor, so that there was a connection there to some degree. You might have been familiar with the university. Dartmouth was kind of just down the road from where you were going to undergrad, and the state school in South Dakota makes sense as well. But how much does choice of medical school matter? And at that stage, are you already thinking about which school is going to best prepare you for a certain type of medicine?
I think if you're really dedicated, you really know for sure, you know yourself very well at 21, 22, 23 years of age, then maybe there are definitely, you've got your state schools and then you've got your private schools. Those are the two big, delineations. Private schools obviously cost much more. State school is the more economical choice. However, you learn the exact same thing. You read the same textbooks, you take the same shelf exams. It's the same. I would say if you want to be, if in your mind you've got, I want to be a doctor, I want to take care of patients, I want to see people, go to your state school. I mean, you're going to save yourself a ton of money and you're going to learn everything you need to know to make the next step in your residency. And you're gonna come out very, very well, properly trained or properly educated for your next step. In your mind, if you think, I love research, I want to become a pathologist, I want to become some kind of a bench researcher, I want to go into research and I want to write grants for the developing the drugs, the next cancer drugs. Maybe you want to think about shooting more for some of the more upper echelon schools, I guess, if you will. That being said, you can get to wherever you want to go pretty much if you put your mind to it. If you go to your state school, you get your great education throughout your med school, you decide, wow, I really love research. I really want to go down that line. Almost every med school that I know of offers an MD, PhD combination degree, and you can go on the research path. So maybe that's my little bias, but a lot of people say, you want to be a doctor, you want to treat patients, just go to your state school. You'll get the education and you'll save yourself a bunch of money. So
I'm sure that's good advice. I'm sure it's something that a lot of people haven't necessarily uh, fully thought about. So yeah, what comes next after med school?
So, you go to med school. And again, this has changed a bit over the last 20 years or so. I graduated from med school 20 plus years ago now. So your first 2 years are pretty much at that time and still for the most part more didactic, kind of similar to what you were doing in college. You're sitting in a class, lecture halls, you get biochemistry, physiology, anatomy, histology, which is looking at a microscope, neuroanatomy, pharmacology. You get all kind of your really hardcore basic knowledge type of courses. And then your second 2 years is when you're off in your clinical rotations, doing things like your internal medicine, your family medicine, your surgery, psychiatry, pediatrics, OBGYN, things like that. They try to get you into the clinical aspect sooner now. So a lot of schools, you do a year and a half maybe in the classroom before they really send you out into the clinicals. Like Jay was saying earlier, how much of what you learned in college do you really use on a daily aspect? It's very minimal, if any. So you can even say that probably a little bit about your didactic years in med school. Now, not quite to the same degree as your undergrad, because you need to know your anatomy, you need to know your physiology, and that stuff just kind of becomes second nature when you're ordering or prescribing medications for patients who have different potential metabolic disorders or things like that. You need to know how things are going to interact, but it's not to the same degree as how you're learning it. You learn the central dogma of DNA and how genes and things are made and developed and discovered and things like you don't use that on a daily basis. You need to know how the calcium channel hypertensive medicine works in somebody with diabetes, something like that. So you go through your medical school, and usually by the end of your third year, you kind of have started to think about maybe what kind of doctor you want to be. Some people know I want to be a pediatrician when I was 10 years old, and that's all I ever want to do. I want to be a surgeon. That's all ever. Most people are not that way. And I think if you're considering a career in medicine, you should definitely keep your mind as open as possible. I didn't really have any idea what I wanted to do, what kind of doctor I wanted to be when I started medical school. I really honestly didn't really know until
Hmm.
probably a third of the way through my fourth year. I kind of figured out emergency medicine was my top interest. I thought wanted to be a surgeon for a while. My dad was a surgeon, a urology surgeon. I got into my surgical rotation, and I did not like being in the operating room. It was not something that I cared for. It wasn't a squeamish thing. It wasn't as interesting as I hoped it would be.
Hmm.
So kind of cut that one off quickly.
Was
Uh,
that stressful being in an operating room?
I heard this quote, or maybe it wasn't a quote, maybe just talking about it at some point. There's these Myers-Briggs personality tests. I don't know if you guys have ever taken them, where you go through a test and you figure out what kind of a personality you are. There's some truth to them. Some of them maybe don't capture exactly who you are, but they basically say every kind of specialty is represented with every type of Myers-Briggs personality. So, you can be uh, cool as a cucumber, like kind of low key type of guy and be a surgeon. You can be a super high stress type A personality surgeon. In the operating room as a medical student, you don't do much. You kind of sit there and watch. So the stressful part as a medical student is really on the lower side, even if you were kind of deciding you want to be a surgeon. You kind of sit there, watch, and try and make sure that that the question that the surgeon's going to ask you, oh, what when we're dissecting this, what artery do we need to make sure? And like, oh God, I hope I remembered that from anatomy, or I hope I covered that the night before. You try and you're going to go and do an appendectomy with the surgeon, you're going to go and do a gallbladder, you better read up on your anatomy. So though that's
What,
probably the most stressful part, is being ready for those questions.
was there a support system for you when you were going through that? Like, I mean, amongst your peers, did you feel like you all kind of function almost as a team, or was it kind of a cutthroat environment?
You mean in kind of in medical school?
Yeah. And as you're kind of making your way through that, and as you're struggling with that, like you're getting exposed to those, and then like do you feel like you just kind of had to buckle down on your own and kind of go through this, or did you have like good friends that you said, okay, I got to figure this out, and that, you know what I
I,
mean?
I I think maybe a little bit of both. I made some really great friends in med school. None of them picked the same specialty that I'm in, but still some of my really good friends to this day. And then there were the people who were more, again, like I said earlier, the gunners. Same
Yeah.
thing in pre-med, and there's those same people are in med school where they're aiming for the top score. They got to get the best resident. They got to be the orthopedic surgeon. That's what they want to be. Um, a formal support system through the school, not really. You kind of had to figure it out on your own. There's
Yeah.
probably honestly better support systems now than there were when I was going through. If you had an interest in radiation oncology, which is more of an outlier of a specialty, most people don't even think about a radiation oncology. They're half physicist and half kind of biochemist at the same time. If you wanted to do that, you had to search that out. There was nobody showing you, oh, this is what it takes to be a radiation oncologist. And like, oh, it's something you don't really think about. There's more support for kind of the basic pediatrics, general medicine, family medicine, OBGYN, general surgery. There's a lot of people who could kind of steer you and kind of answer more questions that way. Um, as far as your peers, I think, if you make friends, you get supported through your friendships and your kind of blowing off steam times and your study groups and stuff with your peers. But you kind of had to figure out what you wanted to do kind of on your own. I mean, you had to make that decision. Only you can really make that decision.
Right. Yeah, that makes sense.
Yeah, so students in undergrad have advisors or mentors. Is there anything similar to that in medical school?
Um, not to the same degree. I mean, there is you do, once you pick your field or your interest, or different medical schools have different things. Some of them have a surgical interest group or a family medicine interest group or whatever. The University of South Dakota is a very small school, still is now. It's bigger than it was when I was there, but still less than 100 students per class, or actually 50 students in my class. So it was a very small. and the financial resources were not probably as robust there as they would be at, say, like a Harvard or something like that. So they probably have clubs and societies and stuff for anything you could even think of. When I remember when this is kind of taking it back to undergrad, but I was interviewing in Baylor, and I was in a group and we were walking through, and I was just talking to a guy who was from Texas. I don't remember what town or city he was from in Texas, but he said, "Oh yeah, I'm a part of the Teens for Transplants Club at school." I'm like, "The Teens for Transplant? Wow, that's quite unique. I wouldn't even have thought of anything like that existed." So, it kind of depends, I think, where you are, the resources, the depth of population, how many people are interested in different things. So I went to a smaller school that probably didn't have as many resources, maybe a bigger school would have. So did I have an advisor in med school? That was a question. I don't really recall having one. I'm sure I had somebody who was assigned to me, but I didn't use them a whole lot.
I think just given the number of options, like all the different disciplines within the medical field, it just seems like to me, like not having gone through it or not knowing much about it, like that seems like one of the most, if I were to put myself into that situation, I could see myself really struggling.
Yeah, it is a very difficult choice. I mean, and you don't even know. I mean, you don't know what you don't know. That's, it's a very common thing to say, but you really don't. There are so many options and even small little niches in the small little options that go off on these little branches and offshoots that you don't have any idea. Like I said, radiation oncology, I never met a I've still never personally talked to one in a clinical setting. I know a couple through a couple different like social things, but I wouldn't know what they do on a daily basis. They calculate radiation and tissue and gradients, and I don't really know. So unless you had in your mind, you maybe knew somebody in a certain specialty in your younger years, or you had a connection somehow else to go after that more obscure specialty, I think it would be really hard for you to figure out or be exposed to it. So after medical school, like I said, fourth year, you have a few required electives, or I guess required core courses, and then most of it is an elective. It's mostly made up of elective time in your fourth year where you're trying out these different things you think you might be interested in, and you're going off to different hospitals and different residency programs to kind of audition yourself and kind of put your best foot forward. You feel them out and they feel you out. And then as the middle part of your fourth year comes around, you go into what's called the match. And you may or may not have heard that term before, but that's basically where you've put in your applications to whatever programs you're interested in, and then you rank them. So I'll use myself as an example. By the end of my time in my interview process as a fourth year medical student, I had gone to 10 interviews across the country. I'd gone from, I did an audition rotation out in California, Fresno, California. I was interested at that program in emergency medicine. On paper. It sounded really great. I got out there and it was a fantastic rotation for learning. I learned a lot of things. I was kind of thrown into the fire and kind of had to figure a lot of things out myself, but I learned a lot. But in the end, that's not a place that I really decided I wanted to go. I went across the country to University of Maryland in Baltimore, again, thinking that might be a place I wanted to go. And again, I had a good rotation, but in the end, it wasn't a place where I really felt like I wanted to be. So between those two places and 8 others, I interviewed and then I ranked them 1 through 10. So where was the first place I wanted to go? Where's the second place? And all of those programs in turn ranked me. We have 15 slots for emergency medicine. Where do we rank this guy? This other program might be a little smaller. Maybe we have 10 slots. Where do we rank him? And then it's a computer algorithm. It does its thing. It matches you and the program to your top whatever choices. And then there's a match day, which is generally in March. It's been on St. Patrick's Day for many years, ironically, but luck of the Irish, I guess. And then you open your envelope, it gets passed out, and say, "Oh, I matched in wherever," and I ended up matching at the University of Rochester in Rochester, New York, Strong Memorial Hospital, and that's where I ended up going. That ended up being my first choice, and so I was very happy that they ranked me and I got out there. So that where that's happening, kind of towards the end of your fourth year of med school. You finish up your degree, you go through your graduation, and then you've got about a month and a half to kind of get yourself out to where you're going to be doing your residency program, your training program. And so I moved myself with my parents from South Dakota to New York. And emergency medicine, this is where things get a little different now. Emergency medicine is a 3-year, essentially it's an apprenticeship. Once you finish medical school, you're officially a doctor. You've got your degree, but you shouldn't be treating anybody in a practicing fashion. You don't know enough or much of anything to do that. So you have to do a residency, a training program, and each specialty does it a little differently, different amount of time. And so emergency medicine is 3 years. You get paid, you get paid enough to live on. It's not a lot, for the time that you spend at the hospital, but it's a livable wage, and it's fine. You're not doing a whole lot else other than going to the hospital and coming home anyway, most of the time. So I did that for 3 years. If you want to be a surgeon, say a general surgeon, that's 5 years minimum. You want to be a neurosurgeon, that's 7 years.
Wow.
Pediatrics is 3, family medicine is 3. My wife is a psychiatrist, hers is 4. And then you can go on and do fellowships after in a lot of these other programs. Emergency medicine has some fellowships, but they're kind of different. Toxicology, you could be a doctor at a poison center. Pediatric emergency medicine, EMS, emergency medical systems, international emergency medicine. They're all about a year or 2 after your general residency. So it kind of depends on what you pick on how much time you're spending in your training program afterwards.
So the fellowship is designed to get you more specialization? Is that?
Yeah, so I mean, so say cardiologist, most people know cardiology. A lot of people have seen one or have family member friends who've seen cardiology for whatever reason. So a cardiologist is a total of at least 6 years after medical school. So they do 3 years of internal medicine, which is kind of your general adult doctor who kind of, you think about the person who takes care of people with diabetes and blood pressure and just kind of your general adult physician. You do that for 3 years, then you decide you want to be maybe a cardiologist, and you go on to that for another 3 years. Or you decide you want to be a gastroenterologist and take care of people's digestive systems. That's another 3 years after internal medicine. So those 2 specialties are very long for internal medicine. Like I said, for emergency, there's 3 years. Pediatric ER is another 2 years. Toxicology is another 2 years. So that's just, it helps you kind of niche down even further.
So how did you navigate that next step? Once you're done with your residency, do you just start looking for jobs?
That's exactly it. You kind of start looking your last year of residency. You train at wherever you get matched. So I was from South Dakota, and I matched in a training program in New York. A lot of people would say, all right, I'm ready to go home. I want to go back to South Dakota and practice. Or I'm a West Coast person. I want to go to California, or I need to be up in New England, or I need to be on the Gulf Coast of Texas or whatever. So you start to look for jobs at wherever you want to be. Obviously, your life plays into that choice. Mine certainly did. I met my wife in my training program. She was a psychiatrist rotating through the emergency room, and that's where we met. And so she wasn't finished with her psychiatric residency. She had a year left. And so I just decided to look for a job locally around the Rochester, New York area. And so I ended up staying and working for a year around there until she finished her program. But a lot of people, they're ready to move to where they want to move or where their family is or whatever. And so you start looking for a job. You can cold call hospitals or clinics and send out resumes or whatever. And you're like, wherever I want to be is where I'll start my process. A lot of people end up close to where they've trained because you start to know the hospitals in your region, in your area, and you know what the jobs are like at those places. You've heard from other people in the community or the area. So a lot of people end up staying close to where they've trained, not necessarily planning on that when they started their training, but it turns out that a lot of people stay close to where they trained. Not everybody, but that's kind of how it works.
And what was your expectation about the job market? Did you feel that, once you're done with your residency, you will have a relatively easy time finding employment?
So I would say as a physician in general, you can find a job. You will never be without work. You're never going to go hungry. It's a very solid, steady, you can work. You can probably work close to anywhere you want. That's not 100% true. Certain areas of the country tend to be maybe a little more saturated with certain specialties than others, and maybe are not as desirable for pay reasons or benefit or whatever the case may be. But once you finish and you start, you've been making money as a resident. You've been making like I said, a livable wage. And so you're not worried about that. You take a significant jump up in your earning potential when you finish. And certain parts of the country offer more financial benefits than others. Generally, those are the places that have more of a need for your specialty. If you go into more of the super subspecialties, if you are willing to work in a little bit more of a rural area, you will definitely make a lot more money because they really need you there. And they will pay you, hospitals will pay you a stipend or an extra amount of money just to come and work in their area or for their hospital. But yeah, being a physician, you never need to worry about not having a job, and generally a pretty good job. Now, getting into a little more of, I guess, where I am now is almost 20 years, almost 18 really practicing as an emergency doctor. There are trends in healthcare that are different now than weren't necessarily the same as when my father specifically was in medicine, and even in between his prime years and mine. Um, Insurance companies, reimbursement levels, more and more physicians assistants, nurse practitioners, maybe sometimes vying for similar positions as you. So those are things also that are kind of dependent on the part of the country that you live in, the certain healthcare system that you're most closely working with. So those things kind of pop up more as you kind of get into your job, and you see that, oh, wow, there's a lot more nurse practitioners doing maybe something similar to what I'm doing, and maybe my compensation starts to come down a little bit because of that. Again, you're not gonna ever have to worry about paying rent or a mortgage or feeding yourself or your family, things like that. That's not something that is a stressor in your mind, but you also want to be paid fairly for what you're doing, and those type of things get factored into your decisions too.
Did you feel that that element of job security was something that you appreciated early on? I see that as just tremendously valuable because it's not something that exists in all other professions. I have students that work in my lab with the ideal or the goal of maybe becoming a professor one day, but there simply aren't enough professor positions to accommodate that. That sounds like that's not true for medicine, and that's huge. That's a big deal.
That's a great point. I never appreciated that as I was going through the training process. That's not something I think I really started to appreciate that after I had my first child. My oldest child is now 13. And when you have, I don't know, when you have a kid, a lot of things change. A lot of your perspectives change or get diverted a little bit. And that's when I start to really realize, wow, I'm extraordinarily lucky here. I can pretty much go anywhere I want, have a pretty good paying job, and not be too worried about it. So yeah, I didn't appreciate it probably at that stage. I appreciate it dramatically now.
So the other thing too, you mentioned kids. So I have two children. Um, I could imagine certain aspects of being a parent, the stress goes way down if I was an expert emergency room doctor. Because like all these things like choking and it's all like all these things. So I don't know, it's just very
Yeah,
interesting.
no, that's another thing that I probably don't appreciate like maybe I should. Yeah, I don't. We take our kids to the pediatrician for their well exams and get their vaccines and make sure they do their checkups and things like that. But they've never been to the doctor for any kind of a sickness ever,
Yeah.
because I'll take care of it at home. My son, about a month ago, was my youngest is 7. He was goofing around, jumping on the beanbag chair, and he put his foot through our window. And so he had a big cut, a big laceration on his foot, and he was freaking out. And I was at work. Ironically, I was working in the pediatric ER that day, and I got a FaceTime and I said, "Yeah, I'll bring home some sutures and we'll take care of you when I get home." So, that's something that you don't appreciate it necessarily until you have the kids. That it's just you know what's sick and what's not, and what to worry about, what's not for sure.
Yeah.
Yeah. And I think you just don't think like being a parent, you don't things can happen to you and you don't worry about them quite as much.
Right, right, yeah.
But one of my sons broke his arm, like a displaced fracture. And I,
Mm-hmm.
I was surprised at how much that stressed me out. Like I
Oh,
didn't I didn't really think much of it. And then when you get there, it's just a whole different
It's dramatic. Yeah, the amount of yourself that your heart that you put into your kids, it's really, my daughter broke her arm as well, and I knew what had to be done and what we had to do and how we had to splint it and cast it and all that, but still seeing her in pain and it kind of rips your heart out.
Yeah, so that's another perk of the job, I guess. But so that's my just kind of one of my exposures to emergency room is unfortunately just dealing with like with kids, like getting hurt and having to go there, and you're there at all hours of the night. So what drew you to emergency medicine? Was there, because it just seems like one of the probably the most stressful types of medicine.
It can be, yeah, for sure. I think the first thing was I figured out in my med school course that I kind of liked a lot of things. Like I said earlier, I didn't love being in the operating room. I didn't love surgery. It's not, I found it to get a little tedious and boring. And I just couldn't sit in a surgery for 3 or 4 hours, every day or every few days a week. But I was interesting enough that, I would still like to do a few little surgical procedures here and there. I liked a little bit of everything. I liked my pediatric rotation a lot, bringing it back to my childhood. I still kind of like seeing kids. I still do now. So I liked everything. I liked men, women, boys, children, um, girls, 2 days old, 102 years old. I wanted to see everybody. I wanted to see all the gamut of illness and help people in all different age ranges and different things. And I kind of wanted to know a little bit about all of general medicine. And so emergency medicine was a really good way to do that. You could argue that maybe family medicine is as well. However, when you look at the practice of a family practitioner now, unfortunately, it turns out to be not the same really as what they were trained to do. They get a training in all these different specialties, but what they end up doing is working in a clinic, seeing your 40 patients a day. And that's unfortunately the way a lot of family medicine, and they refer out a lot of things to the cardiologist or the GI doctor or whoever. In the ER, I'm still the first line for all of those things. I'll see a kid coming in with a fever, a kid who threw his arm out, dislocated his shoulder at a baseball game. I'll see a woman who's in her first 3 months of pregnancy and bleeding and maybe having a miscarriage or a tubal pregnancy. See the heart attack or the stroke person coming in. So I see all of the things right there, and I still really like that. I think as a generalist, I still like having a big picture. And to be honest, the next step is probably the schedule. So my full-time schedule, I work about 13, 14 days a month. Those days, unfortunately, are all over the place. I don't have a really good schedule. I'll work a 6 a.m. shift, maybe another one. I'll have a day off. I'll work maybe an overnight. Then I'll have a day off. I'll work a 4 p.m. to 1 a.m. shift, a few days later. So I don't have a really good way to keep myself on any kind of a schedule. And that can be hard on your body as you get older. Definitely my sleep is not great. I don't sleep very much ever anymore. I'm happy if I get 5 to 6 hours of sleep. And I don't eat as well and I don't exercise. I really try to do those things, but it's harder if you don't have a set schedule. But would I trade that? I still wouldn't, because you know what? I'm home on a Tuesday afternoon and I got to take my son to the doctor's office, or I'm home on a Thursday morning when my daughter's having her musical thing at school and I can be there. Where your 9 to 5, your normal kind of traditional jobs don't necessarily let you do that. The trade-off is I work nights, I work weekends, and I work holidays. This year I have to work the Thanksgiving holiday. I'm going to be there. You're having your turkey. I'll be in the ER waiting for whatever to come in. So it's a trade-off. But I enjoy being off as many days or a little bit more during the month that I'm actually working. I work 10 to 12-hour shifts. So my time in work is probably less than your general 40-hour-a-week person. But when I'm there, it's a pretty intense work. You need to be ready for whatever walks through the door at any time. So
Yeah, I've wondered a lot about that. So is there much thought that's put into that, like when they make your schedule, like your sleep deprivation? And I'm just thinking, again, with your job, like having to make quick decisions, really be kind of firing on all cylinders. And then obviously, like you're saying, you work up to 12-hour shifts. Like I assume towards the end of that, like you've got to be tired and maybe you're not feeling as sharp.
So yes, our scheduler at our in our group, he tries to do some of that. Sometimes you can't do it perfectly for everybody. We're a relatively large group. I actually work at one of the busier hospitals, probably I think it's the second or third busiest ER in the whole country. It's
Mm,
extraordinarily busy. We have a lot of physicians in my ER group, I think about 40, 45. So trying to make a schedule perfectly in
yeah.
circadian rhythms with all those people is impossible. He does try and he does a pretty good job at doing that. We also have built-in overlap with our shifts. So usually the last hour to 2 hours of our shift, we have our relief who has come in, and we are just kind of cleaning up our dispositions for patients, sending them home, following up on labs, x-rays, CAT scans. So we're not really seeing anything new and not responsible for anything critical the last couple hours of our shift. And that
Gotcha.
really helps a lot too.
Yeah, I would imagine many people's perception of emergency medicine, much like mine, is influenced at least to some degree by what they've seen on television or in movies. And in that case, emergency medicine is portrayed as stressful, and stressful for many different reasons, but one, because you have people's lives in your hands, and sometimes those lives end while you're taking care of them. And that's true, I guess, for every type of medicine. But um, to what extent does that actually pervade your job? How stressful has that element?
So, giving bad news to anybody is probably the worst part of my job, hands down. Probably a step up from that is giving bad news about a child. Um, I've been fortunate enough only to really take care of a handful of kids who came in and died and had to kind of talk to parents and things about that. And that's truly just heart-wrenching. And I call my own kids and family pretty much right away after that just to talk to them, because that is the hardest thing that I do. But to your point, it's a job as well. You kind of learn how to do that, and so you kind of learn to um, set yourself apart, to detach yourself a little bit to those situations, and you learn how to tell somebody that their loved one has just died, and we did everything we could, and do you under any questions, you understand this is what there's kind of a protocol, there's a pattern that I go through to tell people, this is what happened, and this, unfortunately, your mom, your dad, your aunt, your uncle, has died. And so that is still probably my least favorite thing to do about the job. Um, as far as the stressful situation, somebody comes in having a heart attack, or somebody comes in after a trauma, and they've got multiple broken limbs and a big, collapsed lung. A lot of that stuff, the anxiety of that has gone down because you've done it so much in your career. I would say a younger physician just coming out of training probably has a higher level of stress than I do after, 18, 20 years of doing the same thing. So it's like a lot of other professions in that the more experience you have, the better you are, the less stress you feel towards those more stressful situations.
If something like that happens, does your shift then change for the rest of the day, or is it you still have to
No,
go?
you're still, you still maybe have the 10 other patients you're caring for. You just have to step away and take care of that situation. But then you have to go right back to what those other 10 people need your guidance and your information just as much as anybody else. So it's an interesting thing that I honestly don't think a lot about, to trying to just you put it you take it out, you put it here, and then you put it back in and you go on with your day. And there's not really anything that we did to get
Yeah,
trained to do that. It's just, I think it's something that we all in the field of emergency medicine have just kind of learned how to do. It doesn't mean that the shift in your mind, you think about that patient for the rest of your shift,
yeah.
but you have to also realize that, what, I got to take care of these other people too. So
So you've been learning on this job for the last 20 years or so, Abe, and I think it's probably safe to say that what you were focusing on getting better at the beginning is different than what you're focusing on now. Do you still feel that you're learning, getting
definitely
better?
still learning, but like you said, what I'm learning is different. At the beginning of your career out of training, you're still nervous a little bit about what you've been trained in, how to take care of the patient the right way and make sure, oh, am I doing this? Am I doing that right? What should I do? What don't I need to do? And as you go through your career, you kind of figure that out after probably within 5 years after your training, you kind of get yourself into a comfortable groove as to how you're going to practice. But on the other hand, there are a lot of new drugs out now that were not around when I was in medical school or training. I need to make sure I know how those drugs work, what interactions I need to watch out for, who the best patient is for that certain medication. So the pharmacology is definitely something that you have to keep up on. We also have, as most people probably do, continuing education requirements in medicine. It kind of depends on the state, how many hours of continuing education you have to keep your license valid. To keep my specialty in emergency medicine, I have to be recertified every 10 years. So I have to have a certain amount of continuing education and take follow-up exams. So it's kind of built into being a physician where you have to continue to be on at least learning to a minimum degree, other things you do on your own because you have an interest or you feel like you need to get more experience or information with that. But you have to kind of by definition in any medical field, you have to have continuing education. It's just part of it.
I want to talk a little bit about the characteristics that make someone good at their job and make you good as an ER doctor. And one thing that I've always thought about you, Abe, I mean, for 20 years now, is that there's something about you that makes other people feel kind of safe around you. And I'm not quite sure what that is. Maybe it's just your demeanor. It's probably some element of your physical aspect as well. But I could imagine that characteristic is extremely valuable in medicine, not just ER medicine, but medicine in general. And I'm wondering if you've thought about that or tried to cultivate that, and if you've thought more generally about what makes someone a good doctor.
I think that's a very fair and very legitimate point you bring up about myself personally. I tend to be a very kind of calm person, at least on the exterior. If something is not going well at work and very stressful, I may be extremely anxious inside, but I try and keep things in a very calm and cool situation on the outside, because in the ER, you're working as a team. You have nurses, you have respiratory therapists, you have techs, you have a lot of people who are helping you, especially caring for those more acute and critical patients. And I feel like the more you can keep yourself and keep the entire environment in a calm manner, a calm situation, the better things are going to flow. People are not going to miss things that they shouldn't miss. That's something it's kind of just been my personality my whole life. I don't really know that I cultivate that. It's unfortunately, fortunately, however you want to look at it. I've been more of just kind of a very calm person, and I don't get flustered at much that happens in my life, at least on the external aspect. Like I said, I get anxious and scared and sad and excited about things just like anybody else, but I may express it in a little bit of a different fashion. I do think that helps in the emergency room. I know it helps. I've been told that it's nice to see you, Dr. Butz. I'm glad that you're here today, because I know we're going to have a good shift and we're going to be okay. You know, also being a very good team player in medicine is very important, because it's not just you taking care of patients. It's you plus a lot of other people, and you need to be able to talk to people and not fly off the handle and lose your temper. There's a lot of doctors that lose their temper. Even at me, no other doctor really likes to be called up by the ER doctor, because it's unexpected. It's a source of unexpected problems. Even though you're on call, we have specialists on call. Got the orthopedic doctor on call. I give him a call at 2 in the morning. He's on call. He knows he's going to be called, but he still doesn't like to be called. So you have to be able to interact with people well. Maybe some people who are not as patient as they need to be, but you need to be a team player. I think in the ER and in all of medicine, I think it helps if you're willing to be a team player and understand other perspectives, and at least be able to get along and be cordial and professional with your colleagues. I think is very important.
Yeah. So, Abe, I know some other aspects about you in And one of them is that you're kind of interested in other careers as well, and for lack of a better word, kind of side gigs. Um, and I'm kind of curious about to what extent your profession kind of allows you or allows anybody to explore other chapters of their life, because not everybody is going to be the same thing for 50, 60 years. And I think that there are some professions that allow the flexibility to take steps outward of that, whether it's you have extra days a month to explore these options, or you have enough financial security to explore these options. I would wonder if you could talk a little bit about that.
Definitely, I think medicine in general, it's not the same profession it was 20, 30, even probably 10 years ago. My father's generation, they were a doctor and they were going to be a doctor for 30 plus years. That was their career, that was their identity. That's how they were going to be known to themselves and to the world around them. Is I'm a doctor of whatever, and that kind of defined them. As things have changed over the years, I think physicians are expecting to be more rounded, more accepted to do other things, have other interests. So I think now is actually probably the time, more so in the last 30 years, where doctors want to have a life outside of medicine. They don't want to be defined necessarily by their job. They will be defined as a physician, regardless, one way or the other, at least to a certain degree in society. But in their own minds, they want to have a life. They want to be able to coach their son's little league team, which I do, and I love it. I also, like you said, I have interests in side gigs. I haven't really been able to make them work, so to speak, but I still have an interest in entrepreneurial and kind of business aspects. And my specific specialty allows me to have a lot of outside time to potentially, at least mentally, pursue some of those things if I wanted to, financially as well, like you said. Kind of the caveat to that is there's still a lot of people who come out of medical school with enormous amounts of financial debt. A lot of my colleagues and med students, six figures, one, two, $300,000 worth of debt when they were finished with it all, and that takes a long time to pay off. Even if you're making good money, it can take 10, 20 years to pay that off. And that's another stress that some people have on top of it that may not allow them to pursue maybe something that they might want to pursue. And at the end of the day, being a doctor is still a job. It's still something that you go to and you have done over and over and over and over again. And after 20, 25 years in any job, I would be willing to say that you start to kind of your mind wanders. Well, what if I would have done that? Well, what do I need to do this the whole rest of my life? Some people will do that and they'll be perfectly happy doing that, but other people may want to take some changes. And I think that is something, if you want it to be, you can do that.
Yeah, sorry, just maybe related to that. So like let's just say you wanted to kind of transition away from your career now and dabble in some of these things. Like can you shift the type of medicine that you do? Like could you like or is that a possibility to go from becoming like an ER doctor to like a general practitioner or I don't know how that works.
Yeah, so that's a good question. That's a good kind of way to look at things. Unfortunately, the answer is yes and no. If you wanted to completely change, if I wanted to become an anesthesiologist, put people to sleep during surgery, keep them asleep, things like that, I would have to go back and do a full training program in anesthesia.
Yeah.
I can't make a lateral move into that because it's a 4 or 5 year training program to be able to do that. Would that training program be much easier for me to do than it would be for somebody who's coming out of med school? Yeah.
Yeah.
It would not be nearly the same degree of stress as that other person. The government makes that a little bit difficult to do as well. Most of your training programs, your residencies are funded by Medicare, which most people don't necessarily realize. Medicare money, um, the hospitals don't pay for these residents to work. It comes from federal money. I believe, I don't know the exact number, but it's around $150,000 per year per resident that the government gives to these programs to basically support them in their salary, their benefits, their education. Once you have finished your residency, once you have gone through your residency, if you go back to start again, the government will not give those programs that money. That money, if that program wants to train you in a second specialty, they will have to pay for you to do that. And most programs are not going to want to do that because they're not making any money off of a resident. A resident, despite the federal money that's being given to them, it's a break even or a lose slightly loss to the program to train this doctor just because they don't generate the same amount of income or revenue that a full-fledged physician does. So it makes it a little bit more prohibitive to go back and become a different kind of doctor. In
I
that
see.
kind of you can, so you have a license to practice medicine. Every state gives out their own license. I currently just have a license in Florida. When I first came out, I also had one in New York, but I've let that one expired because I haven't practiced in New York in many, many years. But you have a license to practice, and so you can hang your shingle, you can open your clinic and say, I'm going to be Dr. Butz, and I'm going to treat you for whatever you think you want to treat somebody for. You're allowed to do that. You're allowed to pretty much do what you feel comfortable with doing. A couple tweaks on that is, are you going to find malpractice insurance to cover you for doing something that's not your specialty? That's going to be a little more difficult. Are you willing to take a chance to practice without medical malpractice? I would think that would be a little bit of a folly on your part if you wanted to do that. So you can do that. There's a lot of people, you've seen them, they run a med spa. They were trained in family practice or trained in OBGYN, and they're doing Botox injections, and they're giving you different injections for this and that, and they can do that. That's 100% legal, but they necessarily were not trained to do that stuff.
So Abe, one more question for you. We've gone for a while now. Every job has bad days and good days, and hopefully more of the latter. What does a really, really good day look like for you?
Good day looks like for me. So I probably like working, my shifts are scheduled. Every hospital and group sets up their shifts to work the way that they want. We've got a 2 p.m. to 11 p.m. shift. That's probably my favorite shift. So I wake up in the morning, I can help, get my kids off to school, whatever the case may be. I probably have time to go and get a workout in, go to the gym or whatever I'm going to do. I have time to come home, maybe have a lunch and just drive into work at 2 p.m. I get to work. I'm working with a really good crew. I've got some good nurses that I feel are good. I feel comfortable with them. I've got a good maybe a resident. I'm now actually working in a situation where our hospital has started to train residents. I worked at the same hospital for many years and we didn't have residents, but now we have them. So hoping I've got a good resident to work with and maybe a good physician assistant or a nurse practitioner that I've got good rapport with. Sometimes we even get to work next to another physician. We have pods that we call them in our hospital, and each doctor is assigned to 12 beds, and you're taking care of those 12 beds throughout your shift. They will turn over, maybe once, 1.5 times throughout your shift. So you're maybe seeing 20, 25 patients a shift. You don't necessarily work next to another doctor. We have a couple pods where you do get to work next to another doctor. So I'm working with a good crew with a doctor that I know and I'm comfortable with, and nurses, and maybe a resident. So I've got a good crew of people that I really like, and maybe we can joke around with. Things are working well. The lab is working efficiently. The CAT scan, the X-ray, everybody's getting their tests done appropriately, or not keeping patients in the hospital too long before they can either go home or they have to go upstairs. I have a nice pace going. There's no really snafu of a patient that really takes up a bunch of my time for whatever reason. I can efficiently move through, and then I have a good sign out at the end. My colleague comes in at about 10 p.m. and I sign out a couple of things to them, and I leave just before 11 and drive home. And that's a really good shift for me. So, what that comes down to is really who I'm working with. Do I have a good group of people who I'm working with? That's probably at this stage in my career, the thing that I look forward to the most.
I love it. That was so much fun, Abe. And really interesting too. I really learned a lot, and I kind of wish I'd taken that second semester of physics.
Well, you know what? You're not too late. There are plenty of people who are in their age group that you're in who go to med school, and their careers are not as long, but you know what? You could do it if you really want to do it. I say this to students who rotate with me, residents. You know, if you want to do something in medicine, you just have to work. You just have to do it. You just have to decide to do it. And you could probably say that about a lot of things in life. If you want to do it, you know what? Make up your mind and just go do it.